Bonjour à tous. Hello everyone. Welcome to today's press conference. Bienvenue à la conférence de presse d'aujourd'hui. Je passe la parole au ministre Dominique Leblanc.
Alors, merci beaucoup, Corinne.
Thank
Bonjour
you
tout
very
le
much,
monde.
Corinne. Good
Good
afternoon,
afternoon.
everyone.
Today, I am joined by Ministers Champagne and Anand and Doctors Tam and New. A short while ago, the Prime Minister announced that two companies, Precision Nanosystems and Novavax, are now on track to manufacture vaccines right here in Canada. This means vaccines made in Canada for Canadians. And this is obviously very good news. Pour nous donner plus d'informations, je voudrais
To give
inviter
us
mon
more
ami, le ministre
information, I'd
François-Philippe
like to
Champagne,
invite my friend,
à prendre la
Minister
parole.
François-Philippe
François-Philippe, à toi.
Champagne, to speak. You have the floor.
Merci, Monsieur le ministre Leblanc.
Thank you,
Good morning,
Minister
good
Leblanc.
afternoon, everyone. Bonjour tout le monde.
Good afternoon,
During the
everyone.
COVID-19 pandemic, our objectives have been clear: to provide Canadians with safe and effective vaccines and treatments, and to return our economy and society back to normal. Central to meeting those objectives is ensuring a more robust and resilient domestic biomanufacturing industry. Building biomanufacturing capacity is part of our recovery plan. It is in Canada's interest, both now and in the future, to have modern and flexible biomanufacturing capability within our borders. That's why at the very beginning of the pandemic, we immediately made investments in Medicago, in VIDO, which is the Vaccine and Infectious Disease Organization, the National Research Council, and Abcelera. We moved quickly to expand vaccine and therapeutic manufacturing capacity across our country. Je suis très heureux
I am very happy to announce today that we have signed a memorandum of understanding with Novavax to produce here in Canada its vaccine against COVID-19 at the new Biological Products Center of the National Research Council on Royal Mount Avenue in Montreal. All countries around the world want to produce COVID-19 vaccines. Novavax chose Canada because its leaders are aware of the government's commitment to support the biomanufacturing sector and because of the resilience of the market. I had the opportunity to speak with the CEO of the company a number of times to present to him the advantages of producing vaccines in Canada. At the University of Saskatchewan, the construction of VIDO is continuing on track and should wrap up by the end of the year. A production that could reach up to 40 million vaccine doses a year is expected. I insisted on a quick progression of the construction of the facilities in Saskatchewan and of the National Research Council in Montreal. In normal times, you need 2 years to build facilities that meet the standards. This morning, I would like to congratulate the individuals responsible for these organizations who understand the urgency of the situation.
Today, ladies and gentlemen, I am really excited to announce that we have signed a memorandum of understanding with Novavax to pursue the domestic manufacturing of its COVID-19 vaccine at the new Biologics Manufacturing Center at the National Research Council facility in Royal Mount in Montreal. This is, of course, pending Health Canada approval of both the vaccine and the manufacturing center. Every country in the world wants COVID-19 vaccines made in their country. But the big news is that Novavax chose Canada because they know that the government is committed to supporting biomanufacturing in a resilient market environment. To that end, I had the opportunity to speak to the CEO of the company on a number of occasions to remind him of the benefits of producing the vaccine here in Canada. At the University of Saskatchewan, VIDO, the project that we have there, the construction remains on schedule to be completed by the end of the year, and they project to be able to make up to 40 million doses of vaccine annually. I can't overstate how quickly these two facilities, both at VIDO and the NRC Royal Mount, are being completed. People would understand that generally a new good manufacturing practices facility can take easily 2 years or more to complete. I want to take the opportunity here today to thank the team that have advanced these projects with the sense of urgency that the situation that we are going through is requiring. Today, I'm pleased to also announce two new COVID-19 related investments under the Strategic Innovation Fund. First, an investment of $25 million in Precision Nanosystems Incorporated, or as we call them, P&I, to establish a biomanufacturing facility in Vancouver that will produce the mRNA vaccines to combat COVID-19. At project completion in 2023, P&I projects the capacity to manufacture up to 240 million doses of mRNA vaccines each year. This is truly significant because Canada currently has limited capacity to produce these newer mRNA vaccines. In addition to manufacturing its own vaccine candidate, which we also funded through the Strategic Innovation Fund back in October, the new facility has the potential to attract other international vaccine manufacturing contracts into Canada. This project could lead to other countries seeking biomanufacturing help from Canada. And it's not just vaccines we're talking about here. This facility would advance the development and commercialization of other nanomedicines, including gene and cell therapy for cancer and rare diseases.
The second investment of the Strategic Innovation Fund goes to Markham, Ontario. We are investing up to $14 million to fund development of antibody treatment therapies in phase 2. The antibody treatment seeks to address acute respiratory distress, which is the main cause of death of COVID-19 patients. Health Canada has authorized phase 2 clinical trials, and vaccine doses were administered to participants in trials in Canada. The P&I project, like the other one, was recommended by the Vaccine Working Group and the Therapeutics Working Group. I warmly thank, on behalf of all Canadians, the members of these two groups for their dedication and their judicious advice.
Second Strategic Innovation Fund investment supports Edessa Biotech of Markham in Ontario. There we are investing up to $14 million to advance Edessa's antibody therapeutic candidate to phase 2 clinical trials. The antibody treatment targets acute respiratory distress syndrome, which is the leading cause of death of COVID-19 patients. Edessa has received Health Canada approval to conduct its phase 2 clinical trials and has begun manufacturing and administering to clinical trial participants in Canada. Both the P&I and Edessa projects were reviewed and recommended for funding by experts on the Vaccine and Therapeutics Task Force. And I would like now, today, to take the time to thank, on behalf of all Canadians, the task force members for their ongoing dedication to these efforts and their very strategic advice. In conclusion, ladies and gentlemen, by investing in Canadian research and biomanufacturing capacity, we are advancing safe and effective vaccines and treatments, and we are strengthening our resiliency to future outbreaks. We have the talent, the innovators, and many willing partners who want to build back better in this area. To everyone involved in today's announcement, my message to you is, let's seize the moment. Let's be ambitious, and let's quickly expand our biomanufacturing capacity in Canada. Merci tout le monde. Monsieur le ministre Leblanc.
Thank you, everyone. Minister Leblanc, you have the floor.
Merci, merci François-Philippe.
Thank you, François-Philippe, and we will now hear from our colleague, Minister Anand. Anita.
Merci beaucoup, Dom.
Thank you very much, Dom, and François-Philippe as well.
Bon après-midi, tout le monde.
Good afternoon, everyone.
Comme l'a dit le Premier ministre,
As the Prime Minister said just a short while ago, February is Black History Month, and it's an opportunity to honor, remember, and learn.
Last month, my department, Public Services and Procurement Canada, launched a pilot program to increase opportunities for Black-owned and operated businesses in the procurement process. A total of 9 tenders have been posted. This pilot project is an opportunity for us to understand how better to leverage government procurement as a powerful tool which can allow access to opportunities for diverse groups to advance in our economy. Turning now to vaccine procurements, I have a number of updates to provide. Most importantly is that deliveries of vaccines have resumed and will continue. So far, we have received over 1.1 million vaccines, and we have additional vaccines arriving this week. Doses have already begun to arrive at distribution points in provinces and territories, and we expect an approximate total of 330,000 doses to be delivered over the next 2 weeks. And after that, deliveries will begin to increase sharply. Comme je l'ai déjà dit, et je le
As I've already said, and I repeat, Canada is obtaining all of the promised doses by the 2 authorized suppliers by the end of March. That means 4 million doses of Pfizer BioNTech and 2 million doses of Moderna, for a total of 6 doses by the end of March. 6 million doses by the end of March.
In vaccine deliveries is unfortunate and disappointing. The slowdown is also temporary and necessary to ensure that manufacturers have an increased capacity to produce vaccines in the long term. While the recent focus has been on the currently approved vaccines in Canada, work continues with the other vaccine producers with whom we have agreements. On Friday, Novovax submitted an application with Health Canada for regulatory approval of its vaccine candidate. This is the 5th producer showing promising results in its clinical trials to submit for approval to distribute its vaccine in Canada. With the announcement today from our Prime Minister and Minister Champagne, Novavax is the 2nd vaccine developer, along with Medicago, that is seeking to build domestic capacity for COVID-19 vaccines in Canada for the long term. Of the 7 vaccine developers with whom Canada has signed agreements, 2 have been approved, 3 are under Health Canada review after showing promising results, and 2 others are continuing in their clinical trials. This is a remarkable rate of success for Canada's vaccine portfolio as a whole in a very short time since the discovery of a vaccine, and one of the reasons that we should be confident that there will be sufficient vaccines by the end of September for everyone in Canada who wishes to receive one. Finally, I would like to provide an update on a commodity that has been of recent interest for many of you, and that is low dead space syringes, which are key in extracting doses from vials as consistently and as reliably as possible. Canada has proactively placed orders for 64 million of these types of syringes, Our first shipment is this week of 1 million deliveries and will continue into May. It
is important to note that this federal purchase is in addition to the purchases made by the provinces and territories for the procurement that they themselves put in place. In conclusion, I would like to reassure Canadians that my department and myself are working daily to ensure that these vaccines and supplies are delivered as quickly as possible so that Canadians can get vaccinated as quickly as possible.
These are turbulent times, and our government remains on course and will navigate these waters together. Thank you. Merci, Miigwech.
Merci beaucoup, Anita.
Thank you very much,
we'll
Anita.
Now turn to Dr. Tam and then Dr. New. Dr. Tam.
Thank you. Bonjour à toutes et à tous.
Good afternoon.
There have been 783,589 cases of COVID-19 in Canada, including 20,136 deaths, and close to 52,000 active cases across the country. In cautious good news, national daily case counts have continued to decline over the past 2 to 3 weeks. Over the past 7 days, there have been an average of 4,368 new cases reported daily, which is around 4,000 fewer cases daily than we were seeing just 3 weeks ago. This is a clear sign that the difficult community-based measures that were put in place to control rapid spread are having an impact. However, there is still a lot of infection in our communities, and we must hold fast with these measures to prevent reacceleration of the epidemic and limit the spread of more infectious virus variants. Canada is continuing to monitor for these variants, and to date, provinces have reported over 135 cases of the B.1.1.7 variant and at least 13 cases of the B.1.351 variant. To improve comparability in reporting national laboratory results, we're now shifting from reporting total number of people tested to total number of tests performed. Since the start of the pandemic, there have been over 21.5 million tests performed. Over the past week, there were on average of over 107,000 tests completed daily across Canada, of which 4.2% were positive for COVID-19. There is more good news that comes with declining case counts. That is, we have started to see a gradual decline in severe outcome trends. Over the past week, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by 12% to under 3,900, including 820 in critical care, and fatal cases have dropped by 20% to 128 deaths being reported each day. This past Sunday, we exceeded 20,000 deaths due to COVID-19 in Canada. In the first 7 months of the pandemic, 10,000 lives were lost. But with more rapid epidemic growth during the second wave, a further 10,000 lives have been lost in just over 3 months. As we gather our strength to keep going, I want to acknowledge those we have lost, who were loved members of families and valued among friends and communities across Canada. I know that as Canadians, we are all committed to see things through, to honor those we've lost, show gratitude to those who've cared for us and maintained our essential services, as well as to protect our hard-won progress. And make no mistake, we are making progress, not just in slowing the spread of the virus, but in rolling out vaccines to protect those at highest risk of severe outcomes or exposure. To date, almost 1 million doses of COVID-19 vaccines have been administered, with close to 50% of healthcare workers, over 10% of the population in the territories, and close to 10% of elderly adults over 80 years of age have received at least 1 dose of COVID-19 vaccine. Right now, our good news is still peppered with caution and uncertainty. But if we hold fast to the measures we know are working, we can prevent infections and save lives while vaccine programs escalate. Let's keep working together and giving our best effort. Every vacation travel we postpone, every outing or activity we avoid, shorten or limit to essentials, and all the diligence we apply to hand washing, masking, and spacing will help reduce the spread of the virus. Thank you.
Bonjour à toutes et à tous. Il y a eu 183
Good afternoon.
589
There have been 783,589 cases of COVID-19 in Canada, including 20,136 deaths and close to 52,000 active cases across the country. In cautious good news, national daily case counts have continued to decline over the past 2 to 3 weeks. Over the past 7 days, there have been an average of 4,368 new cases reported daily, which is around 4,000 fewer cases daily than we were seeing just 3 weeks ago. This is a clear sign that the difficult community-based measures that were put in place to control rapid spread are having an impact. However, there is still a lot of infection in our communities, and we must hold fast with these measures to prevent re-acceleration of the epidemic and limit the spread of more infectious virus variants. Canada is continuing to monitor for these virus variants, and to date, provinces have reported over 135 cases of the B117 variant and at least 13 cases of the B1351 variant. To improve comparability in reporting national laboratory results, we are now shifting from reporting total number of people tested to total number of tests performed. Since the start of the pandemic, there have been over 21.5 million tests performed. Over the past week, there were on average over 107,000 tests completed daily across Canada, of which 4.2% were positive for COVID-19. There is more good news that comes with declining case counts. That is, we have started to see a gradual decline in severe outcome trends. Over the past week, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by 12% to under 3,900, including 820 in critical care and fatal cases. And fatal cases have dropped by 20% to 128 deaths in being reported each day. This past Sunday, we exceeded 20,000 deaths due to COVID-19 in Canada. In the first 7 months of the pandemic, 10,000 lives were lost. But with more rapid epidemic growth during this second wave, a further 10,000 lives have been lost in just over 3 months. As we gather our strength to keep going, I want to acknowledge those we have lost, who were loved members of families and valued among friends and communities across Canada. I know that as Canadians, we are all committed to seeing things through, to honor those we've lost, show gratitude to those who've cared for us and maintained our essential services, as well as to protect our hard-won progress. And make no mistake, we are making progress, not just in slowing the spread of the virus, but in rolling out vaccines to protect those at highest risk of severe outcomes or exposure. To date, almost 1 million doses of COVID-19 vaccines have been administered, with close to 50% of healthcare workers, over 10% of the populations in the territories, and close to 10% of elderly adults over 80 years of age have received at least 1 dose of COVID-19 vaccine. Right now, our good news is still peppered with caution and uncertainty. But if we hold fast to the measures we know are working, we can prevent infections and save lives while vaccine programs escalate. Let's keep working together and giving our best effort. Every vacation we travel, we postpone. Every outing or activity we avoid, shorten, or limit to essentials. And all the diligence we apply to hand washing, masking, and spacing will help us reduce spread of the virus. Thank you.
Merci beaucoup, Dr. New.
Thank you, Dr. New.
Corinne, on va maintenant prendre des
So,
questions.
Corinne, now we'll take questions.
Merci beaucoup. Nous allons donc passer aux questions au
Thank you very
téléphone.
much. So we'll move to
Pour
questions over the
chaque reporter
phone.
aura une
For
question
each
et une
reporter
question
will
de
have one
suivi.
question
We
and
will
one
now go
follow-up.
to the phones for question period. Each reporter gets one question and a follow-up. Opérateur, première question.
Operator, first question.
Thank you. Merci. Please press star 1 at this time for a question. Veuillez appuyer sur étoile 1 maintenant pour une question. And the first question, la première question est de Manon Cornelier du Devoir. Please go ahead.
Manon Cornelier du Devoir. Question. Yes. Good afternoon. My question is for Ms. Anand. I would like to know, you said that we will receive all of the doses promised from Pfizer and Moderna by the end of the contract. For the first quarter, by the end of March, does that mean that the European Union signed official authorizations to this effect? Because according to the current rules adopted last week, no unauthorized export can move forward under the rules before me. Answer. Thank you very much for the question. We have been in contact with our counterparts in the EU and member states on this important matter. Minister Ng has stressed to her colleagues our expectation that this mechanism will not affect vaccine shipments to Canada. And she is stressing that point. We will continue to work with the EU and our partners at the international level, as we have done throughout the pandemic, to ensure that our health procurement and medical procurement remains open and resilient. We share Canadians' sense of urgency to ensure access to vaccines as quickly as possible, and our government is acting on this sense of urgency every day. And now the vaccine deliveries are arriving in Canada. They are landing here in our country. These conversations are working currently, and we need to continue to work hard with our counterparts. But now we will be receiving deliveries here in Canada. Thank you. Question, I'll be a bit more precise. I'll quote Section 3, Paragraph 3 of the rules, which says that without authorization, export of merchandise will be forbidden. And it stipulates that the type of vaccine, the quantity, and the deadline. And so I would like to know, have you received authorizations, and if so, for exactly how many doses and what is the timeline? These are documents that must be written down. These aren't just verbal agreements. So I'd like to know more on that, what it says. Answer. Thank you for the clarification. Yes, countries like Canada that signed purchase agreements with vaccine suppliers are considered separately from developing countries for these vaccines. And in English, I would like to add something else.
We have had conversations with our suppliers as recently as this morning and yesterday, who have assured us that the paperwork has been submitted and that the shipments should be fine for this week to leave the European Union. We are expecting our shipments as a result, and all systems are go for these shipments. Thank you. I will just add also that I know that my colleague Minister Ng and Minister Garneau are working very hard on this, and we are coordinating a cross-government approach to ensure that our shipments are intact, and we are in touch with each other and the EU as well as the individual countries every single day. Thank you.
Merci, thank you. Prochaine question, next question.
The next question, la prochaine question est de David Thurton from CBC News. Please go ahead. Your line is open.
Thank you so much. My question is for Dr. Tam. Dr. Tam, in light of the increase in the number of variants, how concerned are you about provinces easing restrictions at this time?
Thank you for the question. Yes, as I've said in my remarks, we have to be, I think it's great to see the reduction in cases, and now, in fact, a reduction in hospitalizations and deaths. Of course, we have many different situations across the country. Not every jurisdiction is the same. So, but I think, in working together with the other chief medical officers, I think the key is to make sure that the relaxation of public health measures are not done too quickly. By that, I mean that the numbers have to be low enough for public health, for example, to really test, trace, and isolate. Those are the fundamental foundations of some of the criteria for releasing some of these measures. And we're still ramping up, of course, the testing for these variants. So I think on the whole, Canada is testing for variants more than other countries, but we can definitely improve on that. And without escalating the capacity for the sequencing to a greater extent, you won't know if you have the variant. And so I think with all of that in mind, local and provincial public health has to really be very cautious about their relaxation of measures. The good thing is that whether you have the variant or not, these measures work. You've seen that epidemic curve go down. We've seen it in European countries that have way more variants in their community. So these are still absolutely fundamental. And we're in a very delicate period right now where vaccines are just beginning to roll out. So I think the message is really hang on in there for a bit longer so that the vaccine programs can accelerate. And for sure, relaxation has to be done very cautiously, taking into account the public health capacity and, of course, the healthcare system capacity.
Is it fair to say, Dr. Tam, that we're in the period where we're seeing community spread of these variants, these more aggressive variants? And you also just said that, we could be doing a better job in screening for these mutations. Can you go a bit more into what we need to start doing and how quickly do we need to start doing that?
Yeah, so I think the capacity to detect variants are different across the country. There's differential capacity. So part of what the National Microbiology Lab is doing with the network of laboratories and the Cancogen initiative, for example, from Genome Canada and other partners, is to ramp that up. So in Ontario, as you've seen, there's been screening for specific mutations, followed by whole genome sequencing. So we're in the process of escalating the detection. I believe that there will be a technical briefing very specifically on some of the details of how this is being accelerated and the investments, of course, in these capacities so that provinces and these networks can accelerate the detection. And not only is detection of the mutations and then the sequencing important, you actually have to link it to the actual epidemiology to determine what the variants are doing in terms of transmission and severity of illness, for example, in the population. So these have to be robustly in place so that we can respond to these variants rapidly. Yes, as you said, I think there are definitely signs that the variants are at least transmitted to a certain extent in community, and we probably are not detecting them all. Because some of the cases in individual provinces haven't been linked back to travel. So this is the initial signal that we need to be very vigilant and very cautious about those relaxation of public health measures.
Merci, thank you. Next question, prochaine question.
The next question, la prochaine question est de Catherine Lévesque de la presse canadienne.
Catherine Lévesque, Canadian Press. Question.
Oui, bonjour à vous tous.
Yes, good afternoon to everyone. My first question is for Minister Champagne.
Donc, le vaccin Novavax,
the Novovax vaccine is not yet approved, so I'm wondering, how can we ensure that scientists at Health Canada remain independent, that there won't be any pressure to approve this vaccine given today's announcement? Answer, Ms. Lévesque. First of all, thank you for your question. It's a pleasure to hear you. Well, listen, let's be clear. These are two completely independent processes. The one followed by Health Canada for approvals of vaccines and even the certification of the facility. But I think the good news for all Canadians today is, and that's what I'm happy about, is that we're able to create in Quebec, Montreal, Canada, a manufacturer, a world-leading manufacturer that will set up shop here. Because I can tell you that in my discussions with the CEO of the company, they have a manufacturing base in 7 or 8 countries around the world, if my memory serves. And in our discussions, it was clear that it was a choice that they came to come here to Canada. And that's great, because clearly we have a plan to vaccinate people this year, but for people who are with us, we need to ensure that we're resilient and ready for the next health emergency. So these are two completely independent processes: certification of the vaccine itself, certification under the best manufacturing practices that must come from Health Canada, and today's agreement, which means that we have successfully drawn one of the major world players on the vaccine scene here to Montreal. Question. So if you'll allow me, well, there's a type of a promise here in exchange for the approval. So that's why I'm asking the question. But I have another question for Madame Anand about the syringes that were announced last week to give 6 doses rather than 5. Last week we were told that we would receive 2 million this week, $1 million syringe delivery followed by another 24 hours later. And so I'm wondering if you could give us an update on that. Thank you. Madame Lévesque, let me just clarify the first part, and then I'll allow my colleague to answer, of course, the second part. Let's be clear. The agreement signed today is a partnership with Novavax. Obviously, in this agreement, there is no promise. It is subject to a vaccine approval, and obviously the approval as well of the manufacturing production, because on one hand, Canadians want to have a vaccine that's made in Canada as quickly as possible, but we also need to ensure these health and safety and best practices that are in place. So let's just be clear that the agreement is that Novovax is coming to set up shop in Canada to produce vaccines, but obviously all of that is subject to the regulatory process, and on the vaccine end of things, also what we call best manufacturing processes for all companies which are in the biomanufacturing sector in Canada need to be certified. Those are two separate things, and as I said in the news, they have chosen to set up shop in Canada to produce their vaccine. And now I will give the floor to my colleague, Minister Anand, for the other part of your question.
Merci beaucoup, François-Philippe.
Thank you very much, François-Philippe.
Merci pour la
And
question
thank you for the
au sujet de
question
la seringue.
about
Au
the
nom de
syringes.
l'Agence de la Santé publique du
On
Canada,
behalf of the
la
Public Health Agency of
SPAC
Canada,
a acheté un total
we
plus
purchased
de
in total over 145
millions
million
de
syringes
tailles
of different
pour
sizes
répondre à
to
une série
respond
de besoins.
to a series of needs.
Environ 50 millions de
Roughly
seringues
50
ont
million
été
syringes
reçues à ce
have been
jour.
received to
Les
date.
fournitures fournies par
The
le gouvernement
supplies
fédéral
provided
pour
by the federal
l'administration
government
de
for the
vaccins vont
administration
aux
of
provinces
vaccines go to the
depuis
provinces and have been sent since November.
nous avons
Under this
activement
framework, we
acheté
have
une
actively
première
purchased
commande
a
de
first
64
order of
millions
64
de seringues à
million
faible
syringes,
volume morts pour assurer
low
l'extraction
dead volume
afin de
syringes
maximiser
to
le
maximize
rendement des
the
doses
performance
par flacon.
doses
Les livraisons
of
à
vaccines.
l'ACC
The delivery
commencent
to
cette
PHAC
semaine
is starting this week
avec environ
with
1
roughly
million prévu
1
pour
million
la première livraison
planned for the first
et un
delivery
autre million
and
la semaine
another
prochaine.
million next week.
Les livraisons régulières
The
se
regular
poursuivront
deliveries will
jusqu'à
continue
la mi-avril.
until mid-April.
Pour la commande complète
For the
et
full
devançant les
order,
livraisons de vaccins pour assurer la
and that can
préparation,
ensure
nous
the
continuons
preparation. We will
à travailler
continue
avec
to work
l'ASPC
with
pour
PHAC
évaluer et
to
répondre
assess
aux
and
besoins des
respond
provinces
to
et
the needs of the
territoires
provinces and
pour les
territories
seringues de 1
for
000 à faible volume mort.
1
Et
milliliter syringes.
on doit se souvenir
We must
que
remember
le
that
gouvernement
the
fédéral
federal
a
government
acheté beaucoup de choses maintenant
buys a lot
pour
of
les
things now for the
provinces et
provinces
les
and
territoires.
the territories.
Les gauze, les bandages,
Gauzes, bandages,
les alcohol swabs aussi.
alcohol swabs as
Aussi
well.
c'est la même chose avec
It's
les
the same
seringues.
thing for
We are here to
syringes.
support the provinces and territories and to supplement their own procurements. We are providing all of these items for them to support the vaccine efforts that they are undertaking. Merci beaucoup.
Thank you very much.
Dr. New, peut-être je peux ajouter quelque chose.
Dr. New, if I could add something, just from the perspective of public health. Currently, the approved labeling by Health Canada for the Pfizer doses is 5 doses per vial. That's what's currently active. We know that the Pfizer made a submission to Health Canada to demonstrate that it's possible, and perhaps the labels could be changed to indicate that it's possible to obtain 6 doses per vial. But what colleagues at Health Canada are assessing is to look at the scientific data and the information provided by Pfizer to ensure whether it's truly possible to obtain 6 doses from each vial in a regular, sustained manner. In order to do so, we know that there are 2 factors. There's human factor. We have received information from the provinces and territories. It's not easy, and it's not certain that in each vial that vaccinators will always be able to obtain 6 doses, because perhaps you need a certain level of experience, perhaps. So there's the issue of training for people who will administer the vaccine. It's an issue, and we are working with stakeholders to improve this aspect. But the other aspect is the syringes, and as Minister Anand indicated, it's an issue that the Government of Canada is working on, but currently it's still 5 doses per vial, and that is what will continue, and our colleagues at Health Canada will continue their work on the matter.
Merci, thank you. We will take 2 final questions. Nous allons prendre 2 dernières questions. Opérateur, prochaine question.
Thank you. The next question, la prochaine question est de Marika Walsh from the Globe and Mail. Please go ahead. La parole est à vous.
Good afternoon. Thanks for taking our questions. I'm wondering if Minister Champagne, maybe or somebody else, can explain the exact timeline for the production of the Novavax vaccine. when will construction be completed at the NRC facility? When will Health Canada give the approvals for production? And then when will production start?
Let me unmute. I think that's going to be easier. Listen, thanks for the question. So the MOU has been signed. The construction, you remember back in many months ago, we had invested about 126 million to build the plant. So what we're doing now is that we're building the plant according to specifications, because the good thing is that the type of vaccine that Novavax has is compatible with the manufacturing process we have at the NRC in Royal Mount. So that's the good thing. We expect constructions to be completed of the plant by the end of the summer. And then we need to obtain certification, as we call the good manufacturing practice, which is a standard which is administered by Health Canada that every, I would say, biomanufacturing facility in Canada needs to comply. So we expect by the end of the year to be in a position to be producing vaccines. And we're talking around 2 million doses a month based on the process and the design that we have seen so far. So end of construction towards the end of the summer. Then there's a couple of months to obtain the certification from Health Canada. And then we would be live to be producing the Novavax vaccine.
Okay, so that's significantly after what we heard from the Prime Minister this morning. So you're saying that sometime before the end of the year, and sometime maybe in the fall or beginning of winter is when that production will start.
Well, what I'm saying is that you have construction, and we are, construction is on the way. If you go to the site, you'll see the money that we invested back in March is bearing fruits. We have already started the manufacturing process, the plant. And like I'm saying, the good thing is that when we were looking for international partners, the Novavax vaccine is compatible with the manufacturing process we've put in place. Now we're doing detailed design. What I'm saying is that construction by the end of the summer, and then there is a few months because that's an independent certification from Health Canada about the good manufacturing practice. When this is done, then that's where you can start production. So our estimate is that you could start production by the end of the year, depending on the certification from Health Canada, that everything is in order. Because on one end, Canadians wants to have made in Canada vaccine as quickly as possible, but they also want to make sure that the plant which is producing that is complying with all the health and safety protocols that are in place in Canada.
Merci, thank you. Final question, dernière question. Oh, opérateur?
I was just going to...
Oh, sorry, Minister Anand, go ahead.
Je m'excuse. J'ai
I'm
quelque
sorry.
chose à ajouter
I
au
have
sujet
something to add
de seringue.
about
Si
syringes,
vous voulez,
if you wish.
il y a quelque chose à ajouter.
There's something
ici.
that I need to add here.
I want to clarify that our orders are for 64 million low dead volume syringes in order to maximize the extraction of doses per vial. And regular deliveries are going to continue through April and the first part of May. However, we are going to see deliveries of 1 million of these syringes this week, and within days, another delivery of another 1 million of these syringes. So I just wanted to clarify that for everyone. Merci beaucoup.
Thank you very much.
Okay, thank you. We will now move on to the last question. Nous allons passer à la dernière question. Opérateur.
Thank you. Merci. The next question, ou la dernière question, is from Lawrence Martin de Radio-Canada. Please go ahead. La parole est à vous.
Oui, bonjour, M. Champagne. Je voudrais d'abord
Yes, good afternoon,
clarifier.
Minister
Vous dites qu'il n'y aura pas de production de
Champagne. You said that there is no
d'ici la fin de l'année,
production by
alors que
the end
M.
of the
Trudeau
year.
semblait dire
When
que ça
Mr.
serait à partir de
Trudeau
l'été.
said that
Est-ce
it
que
would
c'est possible de
be
clarifier exactement? Parce que je suis un peu mélangée.
earlier. Could you please clarify? I'm a bit confused.
D'abord, merci pour votre question.
Answers. First of all, thank you for your question. Let's be clear. The production facility is under construction currently. We expect for construction to be completed by the end of the summer. And then there is a certification process that is conducted by Health Canada. So we think that we'll be able to produce by the end of the year. Now, the time that it takes to certify the production facility may take a couple of months, but there's no certainty at this time because it is an independent process that must unfold with Health Canada experts. It's the same thing for all production facilities, biomanufacturing in Canada. So construction finishes at the end of summer, and then there's the certification process that's necessary for everyone in Canada, and then there's production. So, well, exactly when production will start will depend on the date upon which the factory is certified by Health Canada and that it adopts the necessary manufacturing processes for all companies in Canada. So our last estimates is the end of the year. We should be able to see production of a vaccine. What Mr. Trudeau was referring to was the construction period, certification, and then production. There are three steps. Another question for Ms. Anand. On the Sputnik vaccine, the Russian vaccine, it has over 91% success rate validated by independent experts. I wanted to know whether it was an option for Canada, given that it's been confirmed to be a reliable option. Answer. Thank you very much for the question. It's very interesting, yes. First of all, you must recall that our procurement and contracts with the 7 suppliers are the result of negotiations with the 7 suppliers after the recommendations of the Vaccine Task Force and the Public Health Agency of Canada. So we concluded contracts only after receiving the advice and recommendations and so on and so forth from the Vaccine Task Force. So Sputnik vaccine was not on that list. Thank you very much. This is Dr. New. If I could add something. There are perhaps vaccines all around the world, and Russia's vaccine is interesting, but I think any vaccine can be important if a company wishes to distribute a vaccine in Canada. It needs to bid with scientific data, because I can also look at what's in the news, but it's really important to have scientific data for our colleagues so that they can evaluate the vaccine. So if there is another vaccine approved in Canada, it's up to the ministers and others to negotiate the purchase of the vaccine, but the very important step is to receive the bids and the scientific data to support the vaccine. Thank you. Yes, and also I might add that we have the most diverse vaccine portfolio in the world.
The most number of doses per citizen in the world. And so at this point, what we are aiming to do is bring those vaccines into Canada once the vaccines themselves have Health Canada approval. That's our priority. That's the first track of our vaccine rollout program. And we will continue to bring vaccines into Canada as a result of those 7 APAs. And
also, as Minister Champagne said this morning, another aspect of our strategy is domestic production. So there are 2 tracks for production for delivery of vaccines here in Canada. Thank you.
Merci à tous. Thank you, everyone. This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui. Passez une très belle journée.
Merci. Bonne journée à tout le monde. Merci. Au revoir.
Merci, merci bien.